Each and every day, physicians, nurses, and support staff fulfill the mission of our ambulatory surgery center industry, and that is, our patients come first.
Hi, my name is Debbie Perdue. I'm the manager here at First Hill Surgery Center in the Minor and James Medical Clinic. Our communication with the patient does not end with their surgery here. They go home and we call them the next day. We always make sure we have their phone numbers so that we can get a hold of them wherever they'll be the next day to find out if their pain medicines are working well for them, to make sure that there's no signs of infection, and that they're comfortable and healing well.
In the pre-op area, we have one nurse assigned to each operating room. So at the most, she's only checking in one patient at a time, getting their history correct and doing the necessary things to make sure that they're ready for surgery. In the operating room, it's one-on-one nursing care. And in phase 1 of recovery, when patients are coming out of anesthesia, it's again one-on-one care, one nurse to one patient. When the patient's recovered from their anesthesia enough and they're moved to our step-down phase, it's one nurse to two patients, and that's in the area where they're getting ready to go home. I'm very proud of the quality and the standard of care that the Ambulatory Surgery Center gives.
Patient safety is a primary concern of the surgeons here at the Olympia Surgery Center. We use many different ways of demonstrating patient safety. First off, we follow the antibiotic routine that is a national standard, that the antibiotics are given within a time frame prior to the start of surgery. The antibiotics are there to prevent any possible infections that could occur. Secondly, an example would be the timeout that we do perform prior to the start of surgery. The patient is introduced to all members of the team. There is a permit available, or patient consent, there in the room with the patient. It is, the room is stopped. We show it to everyone. We confirm the procedure and the patient. And this is a high priority safety issue throughout the country to prevent any chance of a safety or a wrong site surgery. We've been very successful with this, and I think throughout the industry of the Ambulatory Surgery Center, it's been very successful because we are following such high standards to make sure that we are treating everyone safely and well.
My name is Kirk Lorimer. I'm a podiatrist here in Bellevue, Washington, and I have been doing cases here at the Surgical Center for about 9 years, I think. I bring my patients here because the care is excellent. They have excellent follow-up, and it's financially, in this day and age, a much better value than having to take patients into the hospital.
Congress is undertaking healthcare reform. It is very important that ambulatory surgery centers are able to compete on a very level playing field and get a fair reimbursement for our services.